Let's quickly enumerate the maternal adaptations in the cardiovascular system. Very important chapter and very important questions also come from this. Cardiac output is increased in pregnancy by 40%, stroke volume and heart rate. Stroke volume increases by 27%, heart rate increases by 17%, right? Now, 50% increase happens during the uterine contractions and 80% increases immediately after delivery. Now, what is the decreasing order of cardiac output? I just told you it is maximum in the postpartum period. So, that is the period that is when the patient is at utmost risk for cardiac failure. So, 80% increase in cardiac output, that means squeezing out of blood into the systemic circulation, that is known as autotransfusion. So, 80% rise in cardiac output means the maximum risk of cardiac failure postpartum, followed by second stage of labor, followed by late first stage, which is slightly lesser intensity than the second stage. Then comes the 28 to 32 weeks gestational period when the cardiac output is 40% increased, and the last is the early first stage when the contractions are very, very minimum. What are the parameters which increase? Venous pressure increases by 100%. Femoral venous pressure is in the non-pregnant state, it is 8 centimeters of water. It goes up to 20 centimeters of water, twice or more than twice. And oxygen consumption is increased. Parameters which decrease in the cardiac system, in the cardiovascular system. The peripheral vascular resistance because of the effect of progesterone. The pulmonary vascular resistance decreases. The AV gradient because the oxygen carrying capacity, although it is increasing, but even the venous blood has good amount of oxygen. So the AV gradient is decreasing, and the blood pressure, both systolic, diastolic, as well as the mean arterial pressure is decreasing. Dopplers will show increased diameters of the atrium and the ventricles, both right and left. ECG will show a left axis deviation with deep Q waves and low voltage complexes in the ECG. X-ray will show straightening of the left border of the heart and a slightly enlarged displaced heart. That is a cardiac shadow. The silhouette of the heart will be increased. The parameters which are not changed or which remain unchanged during pregnancy are the JVP, the jugular venous pressure, also known as the central venous pressure, the pulmonary wedge capillary pressure, the antecubital venous pressure, and the left ventricular ejection fraction. What other changes are occurring in the pregnancy? Heartbeat is increasing by 10 to 15 beats. Apex beat is shifted because of the gravid uterus. It goes more laterally, 2.5 centimeters lateral to the mid-clavicular line, and that is in the fourth intercostal space. The exaggerated splitting of the first heart sound is evident. Second heart sound is normal. The third heart sound is loud and easily auscultated. In 90% cases, there is an ejection systolic murmur on the aortic or the pulmonary border, that is on the left sternal border. In 10% cases, there is a soft diastolic murmur. And in 10% cases, in that second or third intercostal space, there is a continuous hissing type of murmur, which is known as mammary murmur. Lastly, we will discuss the changes in the respiratory system, just what is increasing and what is decreasing. The diaphragm is pushed by 4 centimeters during pregnancy, hence the total lung capacity is reduced by 50%. The residual volume decreases, expiratory reserve volume decreases, the functional reserve capacity decreases, which is nothing but RV plus ERV. The increased parameters are the tidal volume, the minute volume, the inspiratory reserve capacity, the inspiratory capacity, which is a combination of TV and IRV. The IRV and respiratory rate remain unchanged. Vital capacity doesn't change because IRV, TV and ERV, when we add together, becomes the vital capacity, and the total lung capacity, which is a combination of all four, is either normal or slightly decreased. Thank you. This is all you need to know. Very important question and very difficult to remember, but try to remember from this revision. Thank you.